The Johnson & Johnson COVID-19 vaccine is a step closer to approval for emergency use in the United States. The country's Food and Drug Administration said this week that the single-shot vaccine appears to be safe and effective even against the new variants, including the one first identified in South Africa. It would be the third vaccine that can be used in emergency cases in the United States. We'll discuss this now with Professor Mosa Moshabela, Acting Deputy Vice-Chancellor for Research and Innovation at the University of KwaZulu Natal. Prof, always good to speak to you. So this news then coming out of the United States that the Johnson & Johnson jab could be approved for use in the country even as early as today still. How much of an affirmation is that for South Africa's decision to roll it out as an implementation study?
Good evening, Thembekile, and to your viewers. This is exciting news for us in South Africa because rolling out the J&J vaccine using the implementation research process is very restrictive. It's limiting our capacity to expand throughout the country and to expand to rural areas, for example. And so if it is approved by FDA, then we are confident that they will be able to share the dossier with SAPRA in South Africa, the regulatory body in South Africa, who would then look at the data that they have and what the FDA had. It will fast-track the process of approval in South Africa. And government would then be able to start rolling out as part of the government services and not necessarily a research study. So that would be good.
And just as we've received today, the next batch of 80,000 doses of this J&J vaccine in South Africa landing at OR Tambo for further distribution. We've got over 60,000, in fact, of our healthcare workers have already taken the jab in the implementation study. Are there particular things that you're still waiting to see from what comes out of this rollout domestically?
Not really. I think that a lot of what is happening now, Thembekile, it's basically predicted. We are seeing, for example, strict monitoring of side effects or adverse events, and they are very minor. They often last about a day or a few days, and they are very local. Staff are getting more comfortable with healthcare workers are getting more comfortable with the vaccine. We are seeing an increasing demand for the vaccine. And it is at this point that when the demand increases, the country needs to be able to respond in terms of providing the supply. We expect that the free vaccines that we are getting of about 500,000 would be rolled out for healthcare workers for another maybe 2 months, about 8 more weeks of this sort of intermittent supply. But in my view, I think that that intermittent supply creates a little bit of a bottleneck because there is now a sense of urgency to cover all healthcare workers and start distributing to the public. And the public is already asking questions about when are they next.
Mm-hmm. And Pfizer and BioNTech also have said that they're working on a third booster shot for their vaccine, which would then fight the ever-developing variants, including the one that was first identified on our shores at the end of last year. Do you think that companies then are moving fast enough, the pharmaceuticals, and can they get ahead of the development of new variants, or do we sort of have to wait for a new variant to be identified and then develop a booster?
Well, I mean, the way that we have to look at it, Thembekile, is that we have to adapt as we go along because we can't wait. When we wait, the virus continues to grow and it continues to circulate, and the more it's got more chances of changing. So we have to really continue to put pressure on it, even though putting pressure on it can put it under pressure to change. But it's better that we keep it at low levels. So the sooner we can roll out the vaccines that we have with the options that we have currently, then we can always catch up later in terms of small adaptations for variants. Even if we have a new variant coming out later, then the companies will now be on standby to provide those modifications. And hopefully we can get a lot more people vaccinated in a shorter space of time so that we don't give the virus the chance to continue to change.
We're sitting now a few weeks in since mid-February at over 63,000 healthcare workers who've now been given the Johnson & Johnson jab. Minister Zweli Mkhize said the goal is to vaccinate, I think, 1 million people by the end of March. Do you think that's a realistic goal? Will we meet the target?
I think that it will be good to have a more realistic target. I think that this problem of setting unrealistic targets also agitates the country a lot. And I don't think that without the actual approval, we will be able to accelerate our rollout. And without the actual approval, we still depend on this 500,000 that's been donated. But we do need to start making plans on how to roll out the 9 million doses that the minister has mentioned. The extent to which we will be able to roll out to 1 million by end of March is very doubtful. I am actually hoping that we can cover all the healthcare workers latest by middle or end of May. If we can do that with all the 1.2 healthcare workers, I think we would have accomplished a lot. But I do worry that a lot of people with risk factors for severe disease are going to be left too late in terms of getting vaccines. There is now a lot of a sense of agency in order to cover those people before the third wave hits.
And the third wave now, if we do the calculation for winter, would be about, what, 2.5 months, 3 months away from that. So that should be the ever-urgent target, shouldn't it?
Yeah, it should be. But we can actually accept now that we are unlikely to cover the general population with the vaccines before a potential third wave. What we need to emphasize, Thembekile, is one, how to try and prevent the third wave, how to keep the wave really low so that the effects and the impact is low, but also how to then fast track access to vaccines. And we need to really think about how to open up our options in terms of vaccines. So if we can get a booster for the Pfizer-BioNTech vaccine, why can't we get a booster for the AstraZeneca-Oxford vaccine? It's such things that are limiting our capacity to be able to roll out quickly in the country.
Professor Mosa Moshabela with the University of KwaZulu Natal, always good to speak to you. Thank you.